ఏ వాట్రా మచ్చా.
Hey guys, how are you doing tonight? This feels like my OPD chamber. I'm Dr. Jagdish Chaturvedi. I'm an ENT surgeon, ear, nose, throat surgeon, and I'm doing comedy for security reasons. I was born in Bangalore, raised in traffic. You can say pretty much my life has been a standstill. Great, fantastic. You know, it's a tough life being doctors. We get beaten up and all. You know, my only request to people who beat up doctors is at least spare the ones who are married. Yeah, I mean, we get beaten up at home and then at work. Come on, have some respect. It's a tough life, guys. There's a lot of side effects of being a doctor. You know, see, this is what, maybe you're not able to understand. You look like patients to me. Any doctors in the house? I thought so. You look very patiently to me. You know, the way you're sitting in the waiting room like that, you know? It's got a very waiting room feel to this. But you know, we have a very tough life. Let me give you an example of what I face on almost every daily basis, like every 2 or 3 days. Here's a conversation, I'll tell you. 3 days back, there was this patient. Her name was Anishu. Name changed. Have you seen this name change business? What is this? I don't understand the purpose of that name change business. Have you seen that in the newspapers? What the hell is this? Because you know, when you read a news about someone, you never focus on the name. You focus on the act. But when someone puts a name and puts name changed after it, you start guessing the name. Like if you say like, okay, let's say Bhupali slapped 3 people. You know it was Rupali. If it was Hyderabad in the audience, right? You can't guess the name because we have changed the name. I think the foolproof way to do that is to put the real name and then put name changed after it. Because then you can't guess that name. Having said that, Anishu came to me. So Anishu comes up to me and she says, "Doctor, what do I have?" So I said, "You have a viral cold." It's normal, no? You have fever. Fever, so normally I have every day. You have headache. Headache I have every day. It's normal. No, it's not normal. It's a viral infection. Oh, how long will it take for it to go? You know, viral infections take a week to 10 days to go. So pessimistic. Why can't it go tomorrow? Like, see, viruses stay for some time, they grow and then they die. They will stay for a week to 10 days. See, this is the problem with you doctors. You're so pessimistic. Just say, "I will be fine tomorrow." And if you believe in it, you'll be able to cure all the diseases. So I told her, "I hope you are fine tomorrow, but you won't. It will take a week to 10 days. It's my job to tell you." "No, how can you say that? I will be fine tomorrow. See how easily I am saying it. Can't you say it?" I'm like, "No." Say it, just believe in it. Say it, "I will be fine tomorrow." "Okay, you will be fine tomorrow. After 1 week." "No! Say I will be fine tomorrow." "Okay, you will be fine tomorrow." And she goes. 3 days later, "You told I will be fine in 1 day. 3 days over, I'm still having sore throat." "Hey, I told you it will take 1 week. Couldn't you tell me before? Who made you a doctor?" I have to face this every day. What are they playing doctor with me? What? Where's Anmol? Anmol went away. Where's another kid? You know what doctor means? What is doctor? When I say doctor, what is coming in your mind? Game. Somebody's playing doctor, right? I asked my niece, right, what do you call this game? Because I wanted to use this in my stand-up, right? What do you call a game where a doctor sees a patient? Doctor. It's a simple head nod, repeating the same word twice, and you understand what it is. I get that logic. I asked her, "What other games you play? What if you're dressing a doll?" Doll. "What if you're making a house?" House. "What if you're catching someone?" Catch. So logical. We adults confuse everything. What if we were to just describe things like this? What does Modi do? Tax. What does Malaya do? Loan. Then gone. What does Rahul Gandhi do? Mummy. Kejriwal do? Cough, cough. What do peacocks do? Tear, tear. A very politically aware person is laughing. Please give her a big round of applause. She knows her politics. Let me swallow my tears. I'm not a peacock, guys. Even though, yeah, I'm a clean comic, I'm not going down that road. Yeah. It's tough being a doctor, man. A lot of side effects of being a doctor. You know, one side effect, I need to let the population of patients know how difficult it is for doctors. They should just beat me up. You know, when we finish our studies, we are already old. My friend was so bored during his MBBS, my professors used to call him sir. When I used to give exams, he was inaugurating schools. Unfortunately, I did not possess that power of looking old. I still look so young. That doesn't work well in doctor world, guys. Nobody wants a young, immature doctor. My daily patient seeing is like this. Dr. Chaturvedi आए क्या? मैं हूँ Dr. Chaturvedi. मैं अभी आता हूँ. Hello. It's good for us to look old. Good side effect to have. For us doctors, there is no opinion is a first opinion. You remember that? Our right for first opinion is taken the moment we become a doctor. Because first opinion is our own. Every opinion we take is a second opinion. We are obsessed with exams. That's another side effect. We are so obsessed with giving exams that everything we do with patients is called an exam. We are going to examine you. We're going to do a general physical examination. We're going to evaluate you. We're going to give you tests. Liver tests. Blood tests. Kidney tests. Renal function tests. And then we are going to look at the results and we're going to mess with your head. Because positive means bad. Negative means good. Exams. How many exams we have to give? My wife talks to me, I'm like, give me MCQs. ABCD. None of the above is never an option. I would love to have none of the above when I'm talking to my wife. Always all of the above. It's tough, man. It's tough being a doctor. Once a doctor, always a doctor. Always a doctor. I can never quit being a doctor. Right? Here's what I have to do. I did a show last time, just 4 days back, Canvas Laugh Club, Mumbai. 250 people came. Everyone applauded at the end of the show. They come and stand up in a queue. I thought they will take selfies. They come to me and say, Dr. Saab, so much laughter, some ringing sound is in my ear. I laugh so much, my voice has become sore. Like, I don't have my tools. Torch here, isn't it? I'm like, what is happening here? Then I realized in Mumbai, my ticket fees is half the price of normal consultation fees. People are like, as a doctor at comedy end में consultation fees. I'm sitting at the end, I'm seeing patients. I operated 4 of them in the last 4 days. What is this? So once a doctor, you're always a doctor. Somebody gave me this advice. See, you're 33-year-old, you're not connecting to the young audience, right? Why don't you come up with young jokes? I'm like, what is young jokes? Should it be brand new jokes? What is young jokes? Like, no, talk about Snapchat, talk about Tinder. Like, my wife will leave me. So, no, go on Tinder पे जाके तो देख. कुछ comedy material मिलेगा, kids will laugh. Otherwise, your audience is full of like elderly people. Namaste. You know? So, I was like, okay, let's go to Tinder. So I go to Tinder, right? Within 5 minutes, I get a match. Thank you. Very quick match. So this girl basically asked, what's a doctor doing on Tinder? So I told, this is the only place I won't get a consultation. But, let's make it clear. She said, what are you a doctor of? I said, ear, nose, throat. Acha, when I take bath, my ear gets blocked with water. So I told her, when ear gets blocked with water, it's most likely wax. So take Solivax ear drops, 3 drops in the morning, 3 drops in the night. Take it for 7 days and come and see a doctor to flush it out. Unmatched, thank you. I unmatched immediately because they're like, free ka consultation ho raha hai. No, once a doctor, you're always a doctor. The other side effect is we can get beaten up. Literally. And all the doctors we start getting beaten up. No, we never thought this profession would ever get that kind of a thing, right? So we had a meeting. We had like an annual meeting, and all my friends from different fields we got together. So let's brainstorm. What do we do if some attender comes to beat us? What should we do? So we made a theme that everyone dresses up like the way their idea is. So everyone came. So one guy came dressed like he was going for a cricket match, like opening batsman, padded leg pad, abdomen guard, stomach guard, this guard, that guard, helmet, surgical gloves. He has to operate. He's an orthopedician. Let me protect my bones. Good idea. Another guy, he tattooed the national flag on his body. It's like if anybody hits me, it's an anti-national. He was a dermatologist. One guy put the state flag on his glasses. Because whenever riots happen, if you put these state flag on the glasses, nobody beats them. This guy was an ophthalmologist. He's like, meri aankhein sab kuch hai. One guy suddenly, we were looking at all these guys and suddenly, some guy got a Labrador. And this guy was like, oh, this is a lab dog, it can get lab tests. Whatever coat it's wearing is already lab coat. And it's white. This guy was a pathologist. Right? One guy came with a gun. And he just shot someone. Like one attendant was just acting finicky, he just shot him. He was an anesthetist. He gave him a tranquilizer. And there was one doctor who came with bodyguards. She was a gynecologist. There's one doctor who didn't come with anything. And we were like wondering, yeah, if anyone beats you, you don't want to do anything. He's like, no, I have a plan in mind. What plan? Listen, if I see an attendant getting agitated, I take out my phone and I play the national anthem. Everyone stands still. Till the security arrives. This guy was a psychiatrist.